Hello, welcome to What the Flip podcast. I'm your host, Victor Vogel. We're going to go into fact number 8 this evening, which is going to be a deeper dive into what the costs are uh, for us going on in America today. So uh, we'll take a second, make sure that we're live here on Facebook. It appears we are. There we go. So let's just delve right into it. Up up to this point, we've covered a whole lot about the cost of healthcare, how much it costs, how we compare to other countries. We're going to do some comparison on a little deeper dive into that tonight, also. But how we cost a lot more than the average democratic country that has a free economic society. We talked about where that money was being spent. It was being spent within hospitals and professional services primarily, not high drug costs, believe it or not, although that's an issue in America and certainly a burden on lower cost, lower income people. Uh, but it it's not the primary driving force for a high cost of healthcare. It's only about 9%, where hospitals are 30% and professional services equal 26%. The rest is divided into, you know, senior living homes and other things like that, insurance premiums, etc. But those aren't the primary driving high part of high costs. It's a hospitalization and the professional services that we dug into how that's impacting us from the standpoint of the 90th percentile bracket in spending down to the 10 percentiles of spending and the spread of that and where it's found and to what degree, how that related to age and not necessarily to age, and how it's difficult to measure that because it's random. Like a person may be very young, all of a sudden be in a car wreck, and then become a 90th percentile user for the rest of their life, and they may only be 20. And so that happens in America, what makes our healthcare system extremely difficult to use in that process. So that's part of what we're doing right now. And then we took a look at breaking it down even further into uh, people who were healthy and not so healthy, and how that impacted the cost. And then last time we looked at the disparity within communities of healthcare costs, just within looking at communities, say in the northeastern part of the United States versus a place like El Paso. And El Paso has an extremely high healthcare cost compared to some other cities. And then also within the cities for certain procedures and stuff like blood tests or whatever, the prices varied widely. So we have a big disparity in pricing and how that's all calculated. So tonight we're going to go into something a little deeper into comparison against other countries and costs for that. So that's kind of where we are to kind of catch you up. These are all posted on what's streaming underneath me, which is the facebook.com What the Flip podcast page. If you go there, go to videos, you can see a section called Attack on America, the Healthcare War. And under that is a series of videos that post pretty soon after I do them. They get posted on that Facebook page so that you can get the full gist of what's going on in our healthcare, because we need to fix it and you need to have enough information to know what your representatives are offering you or not offering you in terms of fixing healthcare so it takes care of everyone in America equitably, and everybody can put that burden off to the side while they're thinking about other things. Now, We also know from this series that this pandemic we've had in 2020 has highlighted so much of the train wreck of a healthcare system that we have. So it was bad before the pandemic. The pandemic just made it even worse and brought it all to light even more. So that's kind of where we are right now. And what I'd like to do is just go ahead and share my screen here for a second. If you can give me just a moment. There we go. We're up. This question is fact 8, or actually it's not a question, it's a fact that we're presenting. The United States pays more for healthcare services than other advanced economies. So the United States has dramatically higher, a much higher healthcare prices than any other advanced economy that's out there in the world. Now, that points out some issues. If you understand this and you look at this information and you see it as factual, which it is, you can go validate it on yourself. You can deny it after you see it, but the facts are not going to be lying to you. The idea that if you went to a Medicare for All program, that your health care would suffer greatly, that you wouldn't be able to pick your own doctors, that your doctors would all just quit and leave and go do something else is pretty ridiculous, because the reason our prices are the highest is we are by far the most expensive country in the world, and we're the only country that operates this way. So if we became a single payer system or a Medicare for All program, doctors would not be leaving the United States to go practice like they are here somewhere else. It doesn't exist in the rest of the world. And they most likely wouldn't leave this environment anyway, because it's the best living environment in the world. But the healthcare isn't the reason for that. It's the freedom that we have. So your doctors aren't going to run off. They're not going to become windmill tower experts and become part of the green workforce world because they spend too much money becoming a doctor. They would have to give all that up and work on something else. Besides that, under the Medicare system, what doctors get paid and hospitals get paid through the Medicare system is an exceptionally high standard of living. It's just that we have gotten greedy with this system. So, and it's led to what we're going to discuss today. For example, the United States has dramatically higher healthcare prices than other advanced economies that are out there. And this is the case for surgical procedures, diagnostic tests, prescription drugs, and almost any other aspect of healthcare you want to look for. And we're going to look at a figure that compares some countries as a percentage of the U.S. price for selected healthcare services. And for example, Humira pen costs between 16% in South Africa, and I believe this is like an insulin pen, and 55% in Germany of the U.S. average price. Those are percentage of our average price. So let me just take you down to this chart to see what we're talking about here. Well, what you see here are hospital admissions, prescription drugs. Here is the pen, the Humira pen. I believe that, like I said, it's an insulin pen. This is the average price that we pay in the United States. And you can see everything that happens in healthcare is below, considerably below the cost of the United States over here. So if you took the average price for the United States, this is where these people fall, either 25% below, or in some cases they're only 25% below us at 75, or in some cases maybe even 10% below for this particular situation here. These are high cost items. But just for this pen, Australia, um, South Africa, the UK are well below. They're like 90% below our price structure for this pen. Okay, so you have to ask some questions. And then if you look up here, here's something I know about hip replacements. Okay, so a hip replacement, if I would have had my hip replaced in Holland, it would have only cost approximately 10% of what I would have was charged here in the United States. And so you see those costs are fairly phenomenal, really. And nearly every place else in any of these countries, I would have been well below, 50%, probably close to 50% of what I paid or what I would have paid in the United States. Okay, so let me just go back up here and cover that a little bit for you, because I think that's important. So relatively high U.S. prices are not just about higher prescription drug prices and the implicit subsidies that the United States provides to the rest of the world, by paying the fixed cost of drug research and development we have here in the country. The United States also has higher prices for outpatient procedures like colonostomies and MRIs and cardiac catheterization, and hospital procedures like C-sections and bypass surgeries and things like that. And it actually gives an example here. So it says, for example, a hip replacement surgery costs between 21% and 64% of the average price in the United States. And the average price is somewhere around, in the United States, between $75,000 and $100,000, maybe a little more than that. These patterns are consistent with research showing that high U.S. prices are an important part of the U.S. spending on healthcare. So what's being charged? And I try to figure out, I've said this through several of these other videos, I try to figure out exactly, I try to break this down, because my supplemental group, they provided me the information, a breakdown of the cost. So I actually got to see the retail cost. Well, I didn't get to see the breakdown retail of every individual thing that happened to me, but I got to see the breakdown of the overall cost, and the overall cost for me was $75,000. They called it retail. $75,000 for hip replacement. Now Medicare negotiated that down to around $30,000. Okay, so that's how Medicare, if you were comparing not private insurance like this is, generally speaking, but if you threw in Medicare, or if you look at Medicare, so actually, if Medicare is thrown into this, and I'm not sure whether it was or not, if Medicare was thrown into this, we would have been somewhere down around on a hip replacement, well in the middle of these other countries. We would have been comparable to them. But if you were using private insurance, so private insurance may have not gotten that cost down from the 75,000 to the 30,000. They may have negotiated another 10,000 now off of it or something like that, but it wouldn't have been what Medicare did, because Medicare has an extremely powerful force, large numbers of people, and they have consistent standards where they set prices for, this is what we consider acceptable standard for a hip replacement. And we're not going to, from everything from the time you enter in the hospital emergency room to you leave that hospital, and even afterwards as you do tests and other physical therapy or whatever after that. So Medicare negotiates that if you are on Medicare, my total bill for this thing, around 30,000 instead of 75,000, probably falls well within this category right here of other countries. That's Medicare. If I was a private citizen, I probably wouldn't have got that negotiated, and I would have been way closer to this line over here and much, much higher. So if you happen to fall on ice and you're 25 years old and you have to have your hip replaced because you broke your femur right at the hip, you're going to find yourself paying something like 75 to 125,000, and that kind of varies. We saw that in the last session. It varies from city to city, state to state, across the country, and the prices vary a whole lot. You see that what's interesting is pricing for all of the hospital admissions and prescription drugs, generally speaking, except for outliers like this, are clustered very close together in all of these other countries. They're very closely clustered. We are the only ones that have an exceptionally outlying high price out of the structure of healthcare. So you take hospital admissions, in this case, prescription drugs. What we have not, it might have been really nice if within this article they would have put a listing for professional services here too, which I'm thinking is probably harder to get because the variability in the country on professional services. That's your general doctor and your general practitioner doctor, and even specialists vary so much. It may vary from hospital to hospital in the same city. You can't find this information out, and that's kind of what this is saying right here. Higher prices indicate underlying concerns that are different than those indicated by high-use healthcare. So this is what we get down to, the hospitalization professional service sectors. It's not so much about high usage, the older folks who use it a lot, for example. Most of them are on Medicare, and those doctors accept Medicare because it is a good, dedicated, fairly stable, and reliable source of income. Good income, not bad income. They're not taking a significant hit for what they do. For example, I think I mentioned once that my hip replacement ran something like, I had one doctor who was an emergency room doctor that was not in network but working in an in-network hospital, and we got into a debate over what we should pay her because she sent me a separate bill for $1,500. She ended up taking $400 when it was over with. So that was negotiated down $1,100 right there on the spot. That's just one bill in that $75,000 bill. Just one bill. So that's what I'm trying to say is you have a hard time understanding how they came up with an emergency room doctor who spent a grand total of 8 minutes in the room with me. Now, they're taking liability for deciding what to say and do. I understand all of that. But think about this, $1,500 for 8 minutes. Start multiplying that out and an hourly wage. And it gets to be rather ridiculous, but it gets to be rather ridiculous even at $450 or whatever she charged, ended up settling for 8 minutes is still an extremely high hourly rate. Okay, because I mean that's it. I mean, she was in there. I was awake and alert enough to realize how long she spent with me. I never saw her again. I was, sent the X-ray. I came back and they wheeled me into another ambulance and sent me to another hospital for surgery because they didn't have a surgeon who could do it there. Small town in Brighton, Michigan. So the deal here is that cost. That cost, you can't. How do they derive that cost? Well, Medicare has figured it out. They said, here's what your skill is worth based on the skill, whatever this, and it costs more for brain surgery than it does hip replacements, and hip replacements cost more than appendectomies and things like that because more specialists are involved. But somehow we quite haven't gotten our arms around how all those costs are calculated in the private sector of the business. If you have private insurance, it's not Medicare. And that's what's driving our cost up. Is like I said, if we took my hip replacement and compared my hip replacement against a hip replacement in all these other countries, we'd be right about in the middle. We'd be in this grouping over here, as opposed to over here. If I had private insurance, and particularly if I didn't have insurance at all, I'd probably be paying $125,000 or $75,000 to $125,000 for a hip replacement. That's quite a bill to tag on. So that's one of the problems for all these people who are being laid off during the pandemic, and they are no longer have health insurance. Excuse me, my throat's getting a little dry. So let's back up here. This is a very important paragraph, so I'll just read this. It says, high prices indicate underlying concerns that are different than those indicated by high-use healthcare. In particular, prices so far above those other countries can reflect what in the medical business, this isn't about housing, this is about medical terms. It's referred to as rents, and it's defined as payments to the healthcare system beyond what is necessary for normal rate of profit. Okay, so you might think of it as price gouging. These rents are driven by market imperfections. We talked about that, where hospitals are, groups are gobbling up hospitals and putting them under their umbrella, kind of like AT&T started growing and gobbling up all the communication industry, and then they finally broke them up. But they just gobble them up. So you have these conglomerate hospital groups, and then they move out of the rural areas into the urban areas because that's where the vast majority of money is. And it's not out in the farming country, it's in the big cities, it's in metropolitan areas and urban areas where there are a lot of people, a lot of older people, etc., as opposed to sparsely out in the other. So consequently, for marketing purposes, for making money, for making profit, and making larger profits, it's better to go into these urban areas and set up your hospital systems, and then force doctors to come into your hospital system so that they can't, become too competitive on their pricing outside of your hospital group. So they kind of force doctors to put themselves into the hospital system, or they don't have as great access to the hospital, etc., or maybe a testing facility they have that they would use periodically, they wouldn't get to use, or they'd be put on a wait list or something like that. So this is why your practitioner is beginning to send you to the emergency room or to other med center areas, because as opposed to coming to your house to see you or having you come to the office after hours or something like that. And it also takes all of the collection aspects out of it. That belongs to the company, of the hospital company now, and not the doctor. So they have to charge, of course, the hospital rates for their services. And the only check on that really in America is Medicare. Medicare actually negotiates the prices down, and nobody gets around that. The hospitals don't, and the doctors don't. And yet their pricing structure is earning them a good living. It's just they're not in this rent section where payments to the healthcare system is beyond what is necessary for a normal rate of profit. So, normal rate of profit in an unethical capital system is as much as I can get out of you and drain you of. The more I make, the better, whether it hurts you or not. So these rents are driven by market imperfections like, market power and the difficulty of healthcare patients and other payers that spend money to assess the pricing and the quality of healthcare. And then there's the other costs that are associated with this, administrative costs, and generally, and we're going to see this in an upcoming couple of facts down the road here, generally higher wages for highly educated workers in the United States contribute to relatively high U.S. prices. And this is why companies moved out of the United States to other countries, because they could get their administrative costs lowered and still have people who were fairly proficient at doing the job. And you could do this also, Canada can do this. They may not have as high a wage issue as we do in the United States. And there are a lot of reasons for that. Some people try to blame it on the union, but over the years, and I spent 30 plus years in corporations, it doesn't necessarily break down to that union. It breaks down to a lot of other things. And one of them is if you go public and become stock driven. That I saw that impact a great deal of the pricing, much more than unions or labor or other things that are out there. So all of that tends to drive everything else up, because you gotta pay more to get some. So that's how we start pricing ourselves out of the world here, and that's what we seem to have done here. The rest of the world is fairly stable. We're the ones driving this. We're the ones that are driving this pricing. Now, you might say, well, that's made us number one in the country. What that is not just this that makes us the most powerful country in the world. It isn't just money. That's only part of it. And we could make a lot less, very much down around these areas, and still do better at managing it and have a better governmental system than many other countries have, and still have the resources to be a leader in the country and not have near. In other words, this is way above the normal rate of profitability we need in healthcare to have a good healthcare system in this country. So it's just that we operate differently than the rest of the world, basically, when it comes to healthcare. And what we found and we'll find in, I think, a couple of other upcoming facts is we don't necessarily have a better healthcare product in the end. So this ought to open your eyes and give you a lot of information to ask a lot of questions about, like, why are we charging this kind of money in the healthcare system? Why is that happening? What's going on in the healthcare system that's causing this? And if you try to get answers to this, if you call this is a great time because everybody's into open enrollment in companies and everywhere else, Medicare and everywhere else. So you can begin to ask questions like, okay, give me some examples of what you're going to pay for. Who is actually negotiating down the price with the vendor for me as an insurance company? I'm paying you a premium. Who does the negotiations with the hospitals and the doctors? How does that happen? Explain it. And you're going to get people stumbling all over themselves because they don't know. Brokers don't know. They're the ones giving. The brokers are the ones trying to sell you on the plan. They have no idea. They have no idea how that works. Just ask them. I have been asking, and I can't get a straight answer from anybody. They have no idea. How does a doctor set their prices, say in San Francisco versus Detroit, or Oklahoma City, or uh, you know, Paducah, Kentucky? How do doctors set their prices for hip replacement? Is it consistent across the country? How much is, well, why isn't it? Yeah, they don't have answers for this. They just don't have answers because they're not knowledgeable. That's not part of what they're trained to know. That's kept up at the top of the organization within a very few, very powerful insurance companies. We don't have a free market economy in insurance and healthcare. There are just a few who provide it. They dominate. They dominate. And nobody's moving to change that. There's only one powerful healthcare organization in the United States, and that's called Medicare. That's why when I talk to people about how much are you paying for your Medicare or your health insurance program? Show me. I've got my little chart here. It shows how what I get charged in the hospital and how much what percentage I'll pay and all of that kind of stuff. And I can actually call up Medicare and I can say, hey, look, I'm going into the hospital. I'm going to spend 2 days in the hospital. How much of that is covered? And how much will it cost me? Now, can tell me what yours says, okay? And even if it's comparable, they're paying $12,000 a year for that health care insurance. I'm paying $1,200. So why would anybody not want Medicare for all? If you have everything comparable, and I'm telling you, just call me up. Let's get online. Let's talk about it. I will share my plan with your plan. Let's see what you're paying premium wise versus what I'm paying. And then if somebody is saying, we will put that system in place so you can have what I have and drop your monthly payments by $1,000 a month or $12,000 a year, what would that do for you? And hey, I had a hip replacement. You know what I walked away from out of a retail $75,000, negotiated by Medicare down to $33,000, and Medicare covered the largest portion of all of that. It wasn't that supplemental plan that covered that much. Medicare covered the majority of that. Of course, now I went in the hospital. I think Thursday evening, I was in an emergency room, got into a room about 8 o'clock in the morning. At 1 o'clock in the afternoon, I had surgery. The next day, which that's Friday, and the next day on Saturday, I was up and walking in rehab by noon. I was home Saturday night at 6 o'clock. So, yeah, they push you through faster, which, by the way, is good. It's good. Uh, so, I'm simply saying that out of all that bill, that's $75,000 for that little bit of time in the hospital. Uh, I think I paid $1,100. I don't think you would have paid $1,100 on private insurance. I'm pretty sure you wouldn't, in fact. But we can talk and you can show me yours and I will show you mine. And let's do it in the open so everybody can see us sharing it. And that way, there's no hidden things, no denials. It's all right there. And I'm telling you, you're going to change. If you don't change your mind, you're just stuck on the fact you don't want a Democrat helping build your health care program for you versus a Republican. In fact, I can't even understand why Republicans want to do it. Then on top of that, if it wasn't going to cost you anything, or it just cost you a few more cents in taxes, as an employer, I would back that plan tomorrow afternoon. It takes all of the hassle. It cuts my cost of labor probably by 20%, maybe 25%. Because wages aren't the cost of labor, it's the benefits. The health care and the taxes and everything. Now, sure, I may end up paying a little more as an employer in health care taxes, but when I balance out percentage-wise my cost of labor, it's going to be a lot lower if I don't have to pay your health care or any portion of your health care for you. That's why companies kept moving people off of, used to be in the 60s, early 70s, you had companies pay 100% of health care just to have a competitive draw for employees. And then over 30 years I was in business and consulting, I saw companies take less and less burden of that, push more and more on the employee. Until we are where we are today, where employees pay a pretty good chunk of their own insurance. But they didn't get a large raise to do that. See? So that's what's going on with healthcare, and this is just one more point. We're going to cover more. We got, I think, 4 more facts to cover, and then you'll have the total picture. And then you need to ask yourself, forget whether you're Republican or Democrat. That's not important. It really isn't. Forget whether it's socialized medicine or capitalistic medicine. None of that really counts when it comes down to paying for your hip replacement. It gets down to what is the best solution for health care for you in this country. For you, the vast majority of Americans who might watch this video. Now, I tell you, the elite aren't watching this video. They're on their yachts, they're down in the islands, they're playing the stock market. They're not watching this video about healthcare because they don't have to worry about it. Think about it. Just compare. Find somebody, if it's not me, find somebody who's on Medicare and compare your plan and ask yourself, if I could have what they have, would I pay a little more in taxes? And trust me, you're going to find these other countries are not paying that much more taxes just for healthcare. There's other things they get for all those other taxes too. But if you broke out their percentage of healthcare, I don't think it's going to be that much more. Okay, so there you go. Okay, so we'll see you again Monday. And I've kind of moved these to 9:30 because 7 o'clock doesn't seem to be much of a draw. 9:30, people who are interested might stay up for a half hour, 45 minutes longer and watch us or take a look at us. But you will find this video posted. So you have a good evening. I will see you Monday night. If you decide to join me, you can certainly, put your comments in here. In fact, we had one comment. Oh, here, let's see. This one says, Chinese army at Mexican-Canadian border waiting for Biden's inauguration to take the USA. Google it. Ladies and gentlemen, this is the problem with America. It really is. This is the problem. Can't stand facts. But that's okay. That's okay. There are people who are going to deny. Don't be one of those. Don't be one of those. Look at the data. I'll be glad to do that. I doubt very seriously if the Chinese army is at the border. It's amazing. It's amazing to me. Oh, America, what are we coming down to? All right, you have a very good evening.